Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
This deep dive was created using generative AI tools to support accessibility and clarity. The content is grounded in the research and instructional work of Dr. Michael Jones. Welcome back to the deep dive.
You know, for those of us in mental health, things have really shifted. We're using screens, apps, secure messages. It's incredible, really, the convenience. Mm-hmm. But there's this big question, right? How do we make sure all this digital connection doesn't, accidentally expose vulnerabilities?
That's the core issue, digital vulnerability.
Exactly. So today we're going deep, really deep into data management and, importantly, breach response, specifically for telemental health.
It's such a fast-moving area.
It really is. Our mission, to pull out the key insights, those aha moments, and give you a shortcut to feeling really informed, because this stuff is vital for practice.
Absolutely vital.
Okay, let's unpack this, because honestly, telemental health has fundamentally changed how we even think about data security and confidentiality.
It really has. So, starting at the basics, telemental health is just delivering mental health services remotely, right? Using tech.
Pretty much. Secure video, messaging platforms, all those tools, they bridge the physical gap.
But it's not just about the tools. It brings these new challenges for keeping things confidential and secure.
Right. And what often gets missed, I think, is that strong data security isn't just like an IT thing. It's not just ticking boxes for compliance.
Right.
It's actually a core part of clinical competence. It directly impacts outcomes.
How so?
Well, think about it. If clients feel truly secure, really safe, they're much more likely to engage, to disclose sensitive things.
Which is the whole point of therapy, really.
Yeah, exactly. So your work becomes more effective. But without that trust, that feeling of safety, the whole therapeutic relationship, which kind of hinges on vulnerability, it can just, fall apart.
Yeah, that makes total sense. And we saw this need just explode, didn't we, with the pandemic?
Oh, absolutely. COVID really accelerated everything. Suddenly, it wasn't a niche thing anymore. Everyone needed secure ways to connect, overnight.
And an urgent need for secure data transmission, basically.
Precisely. And supporting that means relying on some foundational technical measures, the behind-the-scenes stuff.
Like what?
Well, data encryption is huge. That means scrambling sensitive info so it's unreadable if intercepted, both when it's moving and when it's stored.
Okay, encryption.
Then you've got strong authentication, making really sure only the right people can access the data, verifying identities rigorously.
Right, not just simple passwords.
Definitely not. And critically, keeping software updated regularly. It's maybe the best defense against new cyber threats that pop up all the time.
So it's an ongoing process.
Constantly. And if you connect these back, these technical steps aren't just tech for tech's sake. They directly support our ethical duties as counselors.
Linking it back to ethics.
Yeah, they ensure we're upholding professional responsibilities, like those outlined in the ACA Code of Ethics, the NBCC Code of Ethics. They all stress protecting client privacy and security.
So the tech serves the ethics, serves the therapy.
Exactly. It maintains that confidential space needed for effective treatment.
Okay. And speaking of frameworks, that brings us straight to HIPAA, right? The Health Insurance Portability and Accountability Act.
That's the one, HIPAA. Remember that long A sound at the end? It really is the bedrock for protecting health information in the U.S.
So what does HIPAA compliance actually mean in a telemental health context?
It means understanding and following specific federal rules, standards for privacy, security, how electronic health info is transmitted.
So like how you use email, store notes, the platforms you choose.
All of that. It has to meet these rigorous standards and, crucially, being ready to handle any potential breaches quickly and effectively.
Okay, breaches. We'll get back to that. But here's where I think it gets a bit tricky for practitioners. Business Associate Agreements, BAAs.
Ah, yes. BAAs. Very important.
What exactly is a BAA, and why should a counselor be so concerned about it?
Okay, so a BAA is basically a required contract. It's between you, the counselor, or practice the covered entity under HIPAA, and any outside company that handles your client's protected health information.
Like the telehealth platform provider. or cloud storage.
Exactly. Your EHR vendor, maybe even a billing service. They're considered business associates. The BAA legally binds them to follow HIPAA's security rules too.
So it extends the protection.
It has to. A really common mistake is just seeing a platform advertise itself as HIPAA compliant and thinking you're good to go.
Yeah, that's not enough.
Nope. Without a specific signed BAA between your practice and that vendor, you're actually taking on significant risk, both for you and your client.
Wow, okay, so counselors really need to vet their vendors and get that agreement signed.
Absolutely, and keep records of them. It's a core part of managing risk.
Got it. So document the BAAs. Now, speaking of digital info, electronic health records, EHRs, they're everywhere in medicine now. What about in behavioral health?
Yeah, EHRs are digital patient charts. Great for storing and retrieving lots of info efficiently.
Seems like a no-brainer.
You'd think so, but interestingly, behavioral health providers have actually been a bit slower to adopt EHRs compared to, say, primary care doctors.
Why is that?
Often it comes down to, well, valid concerns about privacy. Mental health notes can be incredibly sensitive, very nuanced. There's worry about potential misinterpretation if that data isn't handled with extreme care within a large system.
So finding a balance is key.
Exactly. Balancing the benefits of digital records with the absolute need to protect that deeply personal client data. And this also brings up something specific under HIPP, psychotherapy notes.
Ah, yes. Tell us about those.
These are notes counselors might jot down during a session, raw thoughts, impressions, hypotheses, stuff not usually part of the formal medical record. HIPP gives these extra protection, meaning they aren't typically required to be shared with clients, especially if the counselor believes seeing them could be harmful to the client or the therapy process. It's a distinct category.
That's a really important distinction. Okay, so we've talked about protecting the flow of information, the systems. What about the actual content, the clinical notes themselves in telehealth? Do we write them differently?
That's a great question. The standard SOAP format subjective, objective assessment plan is still very relevant. It works well for telehealth notes too.
Okay, so SOAP still applies.
Yes, but there's an added layer. Counselors also need to document factors related to the technology itself, especially if they impact the session.
Like what kind of factors?
Things like, did the client's internet cut out? Was the video blurry? Were there audio problems making it hard to understand each other?
Ah, so the technical context.
Exactly. These aren't just minor annoyances. They can genuinely affect the therapeutic process and need to be in the record.
Makes sense. What else is crucial for telehealth documentation?
Beyond the note format, proactive informed consent is key. Really spelling out the limits of confidentiality in a digital environment before you even start therapy.
Being upfront about the risks.
Yes. Also, having crystal clear emergency plans for remote sessions. What happens if a client is in crisis and not physically there with you?
Critical.
And procedures for handling tech failures during a session. What's the backup plan? These aren't just checkboxes. They protect everyone and ensure care can continue. And this ties directly into the KCREP 2024 standards, the emphasis on professional documentation and ethical practice in telehealth.
It sounds like thoroughness is even more critical in telehealth documentation, capturing that extra layer of context.
It really is.
Okay, so all these safeguards are designed to prevent the worst-case scenario, a confidentiality breach. Let's talk about that. What defines a breach, and what are the real impacts?
A breach is basically any unauthorized access, use, or disclosure of protected health information that compromises its security or privacy. Simple as that, definition-wise.
But the impact isn't simple at all.
Not at all. The fallout can be huge. When trust is broken like that, it can severely damage the therapeutic relationship. Clients might pull back, stop disclosing openly. The whole alliance weakens.
Yeah, I can see that.
And research shows the impact can be especially tough on minors. They often come into therapy already sensitive about privacy, so a breach can feel catastrophic.
That sounds devastating, honestly. So if the worst happens, if a breach does occur, what can a counselor actually do? How do you even begin to address it or rebuild trust?
It's tough. There are really two phases of response, immediate and long-term.
Okay, what's involved immediately?
Immediately, it's about acting fast. A sincere verbal apology is usually necessary. A clear, honest explanation of what happened without oversharing confidential details or just blaming someone else, and taking any immediate steps possible to mitigate the harm.
So quick, direct action.
Yes. But that's really just the first step. The long-term strategies are about structural changes and relationship repair.
Like what?
That could mean revising your confidentiality agreements to make them even clearer based on what happened, implementing stronger privacy measures, maybe changing platforms or procedures, and critically ongoing transparent communication with the affected client to try and rebuild that trust over time.
Rebuilding trust sounds challenging.
It is. Trust repair, especially after a breach like this, is complex. You're dealing with powerful emotions, betrayal, anger, fear.
Yeah.
It's not about making the client get over it. It's about actively working to mend the relationship, understanding their perspective. And counselors need to be prepared for the reality that trust might not be fully restored to what it was before.
Wow. So you have to work within those new limitations.
Sometimes, yes. It really underscores how precious and frankly fragile that therapeutic trust can be.
Definitely. So given how damaging breaches are, how can we be more proactive? You mentioned transparency earlier.
Absolutely. Proactive transparency is huge. Talking openly and honestly about the limits of confidentiality during the initial informed consent process is crucial.
How does that help prevent breach impact?
It helps manage expectations from the start. If clients understand up front that while you take every precaution, no system is 100% foolproof, and they know what measures are in place, it can sometimes lessen the shock and sense of betrayal if a breach unfortunately does occur later. It builds a foundation of honesty.
Setting realistic expectations. That makes a lot of sense, like building resilience into the relationship itself.
Precisely.
Okay, this leads nicely into thinking systemically. We can't just set up our security measures and informed consent and then forget about it, right? This needs to be ongoing.
Exactly right. It has to be a continuous process, and that's where quality improvement or QI methodologies come in.
QI. Tell us more.
QI provides evidence-based ways to systematically analyze and improve processes. In healthcare, a common approach is using Plan, Do, Study, Act cycles, PDSA cycle.
Plan, Do, Study, Act.
Right. You can apply this to your clinical practices and your data security measures. You plan an improvement, you implement it, you study the results, and then you act on what you learn to refine it further. It's the cycle of constant improvement.
So you're always evaluating and tweaking your data handling.
Yes, ideally. It helps catch potential weak spots before they lead to a breach.
And this links back to professional development.
Absolutely. It highlights why counselors need ongoing training in cybersecurity and data protection. This isn't a topic you learn once and you're done.
Things change too fast.
Exactly. You need to stay current on new threats, participate in training, talk with colleagues, consult with supervisors about best practices for digital privacy.
So it's a community effort too, in a way.
It really should be. Ultimately, when you integrate these quality improvement ideas with a focus on data security, you create real opportunities for sustainable improvements, better clinical outcomes, and better patient privacy protection. They go hand in hand.
Wow, okay. We've covered so much ground here. From the technical nuts and bolts of encryption and BAAs to the really human elements of trust and breach response. It's clear this intersection of clinical skill, ethics, and tech savviness is just essential in telemental health today.
It truly is.
And this isn't just theory, right? This is practical stuff for you, our listeners, to think about for your own professional growth and how you deliver care safely and effectively in this digital world.
Definitely. And maybe to help integrate this, here are a couple of reflection questions. As you think about today's deep dive, consider, first, how might the principles of data management and breach response we discussed today show up in your current work or role? Where do you see them playing out? And second, what, if anything, might you want to approach differently regarding data security or client trust moving forward based on what we've talked about?
Those are great questions for reflection. And here's a final thought to leave you with. Remember, in the digital age of mental health care, safeguarding trust isn't just about, keeping secrets safe. It's really about proactively building a secure foundation for healing itself.